Could you first tell us a little about yourself? How old are you? How long have you had prostate cancer? And where are you in your journey?
Well, I'm 46 years old now. I started out on this in October of 2006 at the age of 44 with a high PSA of 19.8. I did research immediately to try to find out which way I wanted to deal with it. It seemed like with an aggressive disease and a high PSA, I wanted to be more aggressive with the treatment. So I was treated in February of 2007 with Da Vinci surgery. And after the Da Vinci surgery, my stage was discovered at stage 3B. My next steps were unclear. We weren't sure exactly where to go, and looking at studies seemed to indicate that the best way to go might be to do follow-up hormonal therapy and radiation therapy, which I completed, and today my cancer is in remission.
Tony, as a well-informed patient who has been diagnosed with non-localized prostate cancer, what do you say to men who tell you, "I don't need to be tested. I have no risk factors for prostate cancer"?
Well, learning the basic numbers in prostate cancer, I've learned that we've got 1 in 6 men will get prostate cancer. If 1 in 6 men are going to get prostate cancer without knowledge of risk, then how do you know that you don't have risk for prostate cancer? So as a general rule of thumb, I like to tell men and their younger age groups to say, you could get a baseline PSA and you can monitor it and you can be proactive and learn what it is, understand what it is, and try not to be reactive.
As you well understand, the current available tests for prostate cancer aren't very good. What should men and patients be doing to spur research that would lead to better tests that can differentiate between indolent and more aggressive forms of prostate cancer?
Well, obviously, it will start with knowledge and awareness. And if people are more aware of what PSA is, what the actual outcome of prostate cancer can be, then they will take the appropriate actions to treat indolent or aggressive cancer based on knowledge. Right now, I find that most people don't even understand at the age of 40 or at the age of 44, like I was, what PSA is. And that's a serious problem. If you look at the breast cancer arena, most women are fully aware of breast cancer and what needs to be done at the age of 25, even younger. And if we could get that knowledge on out to men at that age, I think that we'll come a long way in getting better information.
If there is one thing that you think every 40-year-old male should know about prostate cancer today, what is it?
I can say know what the disease is. It's very simple. Most men feel pretty much invulnerable at that age, and they don't feel like they're subject to that kind of a disease. Its reputation is that of an old man's disease, and knowledge is going to be the key and most important piece. I'll do my part, and I'll let them know, and it generally does open eyes, but we've got to get more commingling among men in order to do that.
You moderate a prostate cancer discussion forum on healingwell.com. Where do you go to get information to keep you up to date about changes in diagnosis and treatment so that you can help the people who rely on you for advice?
Getting information for me came natural because of the fact that I had to go through so many forms of treatment. If I wanted to go to other resources to get information to help people, I would go to websites like PCRI or the Prostate Cancer Info Link. Find experienced people in whatever the field is that a patient might be looking to. It's important to note that as a moderator, my function at healingwell.com is to adhere the rules and make sure that people are coexisting well. But in reality, being somebody who's a stage 3 cancer patient and posted over a couple thousand times, people do look for me in more of the counsel phases, and I caution myself to make sure I speak in the general terms and make sure that they understand that their actual information is going to come from their doctors, and that's the information they should base their decisions on.